Hello and welcome to our channel. Today, we're going to talk about a topic that's crucial for understanding your vaginal health, vaginal discharge. We'll cover what's considered normal, what might be a sign of something more serious, and when you should seek medical advice. Let's dive in. Vaginal discharge is a natural part of a woman's reproductive system. It's produced by glands in the cervix and vagina and serves several important functions, including keeping the vagina clean, moist, and protected from infections. However, changes in discharge can sometimes be a sign of a health issue. Let's talk about the nature and color of normal discharge. Clear or white and sticky. This type of discharge is typically seen around ovulation and is usually normal. It can be thick or thin and may appear somewhat sticky. It helps with sperm transport and fertilization. Milky white. This is common at the beginning or end of your menstrual cycle and is usually due to changes in estrogen levels. It can be slightly thick but should not have a strong odor. Thin and watery. This type is often seen in the days leading up to your period. It's usually clear or slightly cloudy and should not cause irritation or discomfort. Now, let's look at some types of discharge that might indicate an issue. Yellow or green discharge. This could signal an infection, especially if it's accompanied by a strong odor, itching, or redness. It's often associated with bacterial vaginosis or sexually transmitted infections. Gray or thin discharge. A grayish, thin discharge with a fishy odor can be a sign of bacterial vaginosis. It's important to seek medical advice if you notice these symptoms. Brown or blood-tinged discharge. This can be normal as your period is ending, but if it occurs outside of your menstrual cycle, it could be a sign of irregular bleeding or other conditions, such as polyps or fibroids. Persistent brown discharge should be evaluated by a healthcare provider. Itchy, lumpy, or cottage cheese-like discharge. This type of discharge, which can be white and clumpy, may indicate a yeast infection. It is usually accompanied by itching and discomfort. So, when should you seek medical advice? It's important to consult your healthcare provider if you experience persistent discharge, if you notice any of the above abnormal discharges for more than a few days, or if they worsen. Let us now talk about the accompanying symptoms of abnormal vaginal discharge. Accompanying symptoms. Symptoms like 1. Itching, burning, unusual odor, or pain during intercourse or urination. 2. Significant changes. Any new or sudden changes in the color, consistency, or smell of your discharge. When discussing your discharge with your healthcare provider, be prepared to share. Duration and frequency. How long you've noticed the change and how often it occurs. Additional symptoms, any other symptoms you're experiencing. Menstrual cycle information, any recent changes in your cycle or hormonal changes. Before we wrap up, let's address a few common misconceptions about vaginal discharge. There's often a lot of confusion and stigma surrounding this topic, so it's important to clarify. Misconception. Discharge is always a sign of infection. Many people worry that any change in discharge means something is wrong. However, many variations in discharge are completely normal and related to your menstrual cycle or hormonal changes. Misconception: you should avoid talking about discharge. It's crucial to feel comfortable discussing vaginal health with your healthcare provider. They are there to help and provide support without judgment. Misconception: over-the-counter products can fix everything. While some over-the-counter products can help with minor issues, it's essential to get a proper diagnosis and treatment plan from a healthcare provider if you experience persistent or severe symptoms. To maintain overall vaginal health and reduce the risk of abnormal discharge, consider these tips. Maintain good hygiene. Use mild, unscented soap and avoid douching, which can disrupt the natural balance of bacteria in your vagina. Wear breathable fabrics. Opt for cotton underwear and avoid tight-fitting clothes to reduce moisture and prevent irritation. Stay hydrated. Drink plenty of water to help your body stay hydrated and maintain healthy mucous membranes. Healthy lifestyle. A balanced diet, regular exercise, and avoiding smoking can support overall reproductive health. If you're looking for more information or support, there are several resources available. Online health portals websites like the Mayo Clinic, WebMD, and Planned Parenthood offer reliable information on vaginal health. Support groups, online forums, and local support groups can provide community and shared experiences. Professional help. Don't hesitate to reach out to a gynecologist or healthcare provider for personalized advice and treatment. Remember, understanding your body and what's normal for you is key to maintaining good vaginal health. If you're ever unsure or concerned about changes in your discharge, seeking medical advice is always a good step. Thank you for watching. If you found this video helpful, please give us a thumbs up and subscribe to our channel for more health tips and information. Feel free to share this video with anyone who might benefit from it. And don't forget to comment below with any questions or topics you'd like us to cover in future videos. Take care. And see you next time.